Hi, I'm Seema.
Hi, I'm Surili.
Today, we are thrilled to have with us Dr. Gaurab Basu. Dr. Basu is trained as a physician and founding co-director of the CHA Center for Health Equity, Education, and Advocacy. He is an instructor at Harvard Medical School's Department of Global Health and Social Medicine. At Harvard T.H. Chan School of Public Health, Dr. Basu is a Health Equity Fellow at the Center for Climate, Health, and the Global Environment, and faculty affiliate at the FXB Center for Health and Human Rights. Dr. Basu has been recognized nationally for his work in climate change and health equity. He was named the 2021 GRIST 50 list of climate leaders. Welcome, Dr. Basu. So excited to have you here.
Thank you so much for having me, and I'm huge fans of all your work, and so thanks for doing this great project.
As are we. Thank you so much for joining us. Let's dive right in. We're really looking forward to talking to you about your journey from doctor to climate and health equity champion. But before we go into that, can you tell us a little bit about the Center for Health Equity, Education, and Advocacy, and how the role of co-director of the center intersects with all your other roles as instructor and health equity fellow and so many other titles you hold?
Yeah, no, thanks. I think it starts with kind of, the way I approach my work, right, is that, so I'm a proud primary care doctor at a community health center, taking care of a vibrant immigrant community. I think even before I started medical training, I had an appreciation that I wanted to be a part of taking care of people. I wanted to be in the middle of a community that was taking care of one another. And so I really gravitated to medicine because of that. But I kind of was really clear-eyed around the whole way along that you needed structural change and you needed good structures in place to make sure that people are healthy and thriving and healing. And that it wasn't enough for me just to kind of only take care of people after they had been injured or harmed or made sick in their communities and societies. So I think my worldview is so informed by my patients and hearing their stories and, the kind of privilege I have of hearing those stories. But I think it feels really important for me, it feels like a responsibility for me to synthesize those stories and understand what I'm seeing and kind of put a real equity and justice lens on that, and then try to speak to those bigger structural forces. And so the Center for Health Equity, Education, and Advocacy is a center that we've been running for almost 3 years now. And the center runs a number of different programs, both here in Boston and around the country. That is a number of different courses. We're teaching health professionals, all health professionals, how they can make change. And so we teach on different health equity topics, but also ask our course participants to explore their role as change maker. What does it mean to make change? What kind of role do you want to play? Do you want to get into policy? Do you want to do research? Do you want to write? Do you want to work with community organizations? And I think that's a real skill set that's been really left out of our training, and that there's a real hunger for, because I think actually there's a lot of burnout. I think clinicians are seeing a lot of hard things, and obviously COVID animated all this, and they're seeing the ways that poverty and racism and injustice are impacting their patients, but they feel overwhelmed at trying to speak to that. And of course, this all ties into climate, and so for me, my personal advocacy is in climate and health equity and anti-racism. And so, you can't think of a bigger structure than the planet, right? And all those themes of how we need to have healthy, thriving, just structures is kind of centrally relevant to my work in climate change. And so I think my work in climate has mostly been through teaching and writing and doing local advocacy here and engaging in task force in my city and things like that. But for me, it feels very meaningful to engage both in that kind of one-on-one taking care of people, and then also trying to do that broader kind of healing of the structures work as well.
Great point. And, so glad to have you doing this work. And I really appreciate how you highlighted there is no bigger, patient, I guess, than our planet. So I understand the tagline of the Center for Health Equity, Education, and Advocacy is healthcare professionals play an essential role in creating the structural change needed to build a healthy, sustainable, and equitable future for our patients. So, with that understanding, how can healthcare professionals play this essential role? And why now? Why is it so essential for them to be part of the conversations at this moment in time?
Well, I think it goes back to, why does health matter? Like, what is the value system within creating a healthy society where everyone is healthy and they can thrive? And I think inherently in the work of supporting health and ensuring health, it's a moral responsibility, right? That every child in our society can be healthy, that every child, every person could be seen and valued, that their dignity and humanity is valued. I think that's at the heart of what health related work is all about. And so I think healthcare professionals being in the middle of that and being trained in how to take care of patients play a critical role in speaking up for the things that are causing threats to that. And of course, I take my clinical work extremely seriously. It's at the core, the foundation of who I am. It's frankly a lot of work, right, to learn those clinical skills and know how to provide care and be trustworthy in your clinical care. But I think that COVID again taught us that that's not enough, right? You couldn't really ask health professionals this year to do more going into the hospitals and clinics and taking care of patients. COVID and climate, I think, teach us that we have got to put the right infrastructure, the right scaffolding in place so that people stay healthy in the first place, right? And that public health and social medicine and structural justice are all essential ingredients in making sure we stay healthy. And so again, I would just say that, health professionals are seeing the ways in which health inequities are playing out in very human terms. And I think it's critical that they have a role in making policy, in speaking up, in identifying the gaps in these kind of major problems that are preventing us from having the healthy society we want. And so I think, in climate, a lot of what I see the role of health professionals is doing that translational work. The truth is, I do think climate change is confusing, to care about greenhouse gas emissions or invisible threats, or maybe the weather is just fine today. It can feel abstract, and people are working really hard and stressed out and trying to make their lives work. And so when you try to say, hey, we got to decrease our emissions in half in 10 years, that might not connect with them. But if you tell them, hey, this is how it's going to impact your child, hey, your loved one, who is pregnant, having exposure to extreme heat or air pollution increase the risks of poor obstetrical outcomes, well, that matters a ton. And so I think it's critical that we play this role of translator so we can make the work of climate change very human. And I think we're uniquely positioned. And again, that's why I feel like it's almost a responsibility of ours to do that work.
I love that approach. And I think some would say, yeah, that's what healthcare is supposed to do. It's sometimes hard to offer that in a short window. And the way you're approaching it, the way you're talking about it, almost feels like you're even helping patients better equip themselves with some health literacy. So from that vantage point, you got me thinking about what could the patient do? So what can our listeners do when they go and visit their doctor? What kind of questions can they ask that relate to their health and climate or their environment?
Well, I think it's a two-way street, I would say, because I on my side of it, I feel like, health professionals should really be thinking about this and doing the appropriate screenings, right? It's hard to put it on the shoulders of our patients, but certainly, for people who are going to their doctors and wondering, hey, how do I understand this better? Now, I think that doctors, nurses, social workers, psychologists, all should be really valuable sources of information about this. And I think people should be asking, hey, I'm really worried about climate change. I'm seeing the impacts of air pollution. What does that mean for me? Or can you help me understand, where I live or what I work, how I work? Is that putting any exposure risks to me? And if your doc doesn't know, then they should kind of work together to better understand it, because I will say on my end, I certainly have had my blind spots over my career. I think I often reflect on a patient case of mine who was a young man who was a farmer in Central America for much of his life and then immigrated to the US, and was having kind of cold symptoms, viral symptoms, came to the emergency room, was his first kind of point of contact with the medical system in the United States, and his kidneys were in failure, and he had to get urgently dialyzed. And it really turned out that he had CKDU, or heat-related kidney disease. Him being out in the farmlands, working day in and day out in severe heat, had caused what we call kind of pre-renal events on his kidneys, such that his kidney was getting injured day in and day out, and ultimately failed. And that made me think, hey, what are the impacts of heat? Am I really understanding who's at risk? And locally, my construction workers, my elder patients, the babies that my patients have. I'm an adult doctor. When these heat waves are coming, am I counseling them properly? Do they know what to do? Do they have air conditioners? Do they have heat pumps? These are questions that I really had to learn a little bit on my own. I wasn't really trained to do that, to be kind of assessing some of these health threats and counseling better. So we as a healthcare system could definitely do much better. Many people are working on really embedding this into our healthcare delivery system.
Thanks for sharing that story. I think it really helps make it real in terms of what this looks like. And you highlighted a little bit about having to do this learning on your own. I'd love if you could share with us a little bit of what that journey looked like. We'd really like to be able to share some of this as inspiration for others who are looking to take that journey, and maybe they don't know where to start. So, looking at what that path looked like for you would be really helpful.
Yeah, I mean, I consider myself fairly new to the climate work and the climate movement. My background's in global health and human rights work. And so I had worked abroad in India and Liberia and places like that, working on child nutrition and women's health issues. And frankly, I think for much of my career, while I always thought climate change was really important, I had kind of a wake up moment. I had a moment where it really became clear that climate change was a threat to all the things I care about. And that was really the 2018 UN IPCC report. And I can still really remember, I was like waking up, reading the news on my phone, and it said major climate report. And that report, I think, was extremely well written and defined the science in a way that helped a lot of people, honestly, understand what 1.5 degrees Celsius of warming and 2 degrees Celsius of warming, and how soon that was and how dangerous that was. It was my wake-up call. It cast a light on this, and it helped me see climate change in a way I'd never seen it before, and now I can't unsee it. But I basically at that moment was able to appreciate, both as a physician and as a parent. We had a 2-year-old at that time. My wife was pregnant at that time. It helped me realize it was a threat to all the things I cared about. And I think one thing I try to convey when I teach a lot is that you just have to be human to care about climate change. And we could sit down and share stories and better understand what you care about, who you care about, and then very quickly, unfortunately, be able to explain how climate change is a threat to that. And so I think, climate change is an everything issue. I don't think, people can really think about what's happening in their community, what they care about, and then understand how they can find their voice in that. I actually very confidently feel that everyone has something to offer in climate work, that everyone is a climate advocate that can create great impact. You don't have to change who you are or what you care about. I think we just need to do some, education about the way that climate impacts what you care about. And so for me, I thought about all those things, the global health work, the health equity work I was doing, and really that helped me really distill how it was impacting those things I'd been thinking about, throughout the last 15 years.
If I could ask one follow-up question to that, because, since that 2018 IPCC report, there, of course, has been one that was just released that is even more eye-opening. Given the current situation, what gives you hope for the future?
Yeah, for me, it's I would say even more than hope. There's Kate Marvel is this climate scientist who I respect a ton, and she has this sentence in one of her pieces that says, even more than hope is what we need is courage, and I think right now I feel just determined. I think that this has to get done, and we need to make progress. And I see reasons for believing we can make tremendous progress all around us, and that actually does give me a lot of hope. And I think once you can see it, I think everyone can have the opportunity to care about it. I really do. And I think that it's just a matter of doing that translational work, creating awareness. And I just, from 2018 to now, honestly, at a state-based level, that's, I think, one of the things that I feel most energized by, is that there's been so many great state-based bills, and you see how that is changing the scaffolding of our economy. And then probably more than anything, right, is the youth movement of how they've just galvanized this moral voice. Because I do think that this is like fundamentally an exercise in imagination. I think too often we get locked into things can't happen because that's not how we've done it. Like, how could we ever rebuild the world, right? I mean, I think, climate action is nothing less than completely rebuilding the way we do things at a core level. And I was very overwhelmed by that when I started in this work. But I do think it takes some embrace of that boldness and that kind of ambition of saying, we've got to do a lot of deep work and we've got to do a tremendous amount of work. But once you accept that challenge, you see opportunities everywhere, and from my vantage point, all of these actions for mitigating climate change, it provides a cascade of health benefits, right? It can improve so many different things at once. And so that's why I just feel really determined to explain why climate action is racial justice, is health equity, is foundational for my patients, because I think we can do a lot of good at once. And so, and I think the conversation, even at the federal level, obviously, we're having this conversation at a very critical time with conversations in DC, and we'll see how it shakes out. But there's stuff being discussed that was not imaginable a couple of years ago, even. So things can change quickly, things don't change until they do. And we can have transformation. I do see signs of that.
That is really great hope to hold on to. Thank you for outlining it and the way you framed it. I particularly want to lift up what you said around climate action is rebuilding the world in a different way. And part of that is looking at some of those systemic deficiencies across not just the US, but globally. And in the US in particular, in wake of George Floyd's murder and so many other unfortunate run-ins with racism and structural racism in the country, tied to poverty and wealth and all those things. So it's multidisciplinary, if you will, climate action, and I appreciate you lifting that up. As you're talking about hope of especially the work that young activists are engaging in, which has been very energizing, but also very humbling, because younger people are starting to tell us that, as adults, responsible voting members of society are not doing the job they're doing. How do you see that? How do you see the role of the Climate Health Organizing Fellowship Program? You could tell us a little bit about that. How do you see that as advancing more of the advocacy, creating space for newer generation of professionals getting more acclimatized to not just doing the job, right, but to doing it to an extent and a degree that is public facing and is action oriented. Yep. And then, because this is new, I would love for you to also talk a little bit about what does success look like in your eyes? If this program is successful, what would that mean?
Yeah, so thanks for the question. So we're just launching, for the first time, this Climate Health Organizing Fellows program. So maybe we'll give a little detail of what it is and then explain why we're doing it. So it'll be a fellowship in which we're inviting people to apply as groups, actually. So we're asking people to apply as groups of 3. And so folks who have applied already are doing great work in the local communities around climate and health. Many are trying to work at their hospital levels for sustainable food and decarbonizing their hospitals. Others are trying to improve tree canopies. Others are trying to decrease, gas infrastructure. So it's really exciting to see the things that many groups, we were very clear that there was so much great work happening around the country. And we wanted to provide support with some skill building around that. So we're having folks apply as groups. And our idea is that we're going to have a 6-month fellowship that's kind of a monthly course and then different weekend immersions in which we'll teach about health and health equity and climate. But even more than that, we'll be really doing skill building around community organizing and public narrative. And so I've been really influenced by the work of Marshall Gans and his pedagogy, who's a professor at the Harvard Kennedy School, who did a lot of work in the civil rights movement, and then later in his career created a real pedagogical foundation for community organizing. And it's really influenced the way that I think about making change. And in short, his organizing principles is that making change is about identifying and changing power dynamics. And that work starts with declaring your own values, telling your own story, building relationships with people with shared values, and then cultivating relationships in which you can build power together. I think too often, and this is, this happens on purpose, right? That folks who are in power purposely kind of try to make you feel like you don't have power. But in fact, a lot of communities and a lot of people have power if we learn how to build it. And so our fellowship will really be focused on how do we build power around these principles of everyone's humanity, of health equity, of racial justice, all being tied together. And then folks will be working on projects in their local community as we do these workshops, provide personalized coaching in these community organizing skill sets. And so what I'll say just real quickly about why we approached it this way is that we do think these skills will be really valuable for folks in the work that they're doing. But it speaks also to, I think, a bigger thing that I think we touched upon this earlier, but I think health professionals are feeling really burnt out. They're feeling isolated. They're feeling overwhelmed. And, on the heels of an extraordinary year of COVID, and that continues on, of course, people feel like, I think they want to speak to these bigger issues, these broader structural issues that are impacting health and health equity, but they don't know how to speak up for it. And so we really want people to build community. I really believe that a crucial piece of speaking to the big and hard things in the world is building community. So we hope to do all that at once, to do the values-based work, tell stories, build community, build power, and really reframe our capacity in making change. And so I think success would look like that we really do that, all those things really well, and that people feel fulfilled, they feel connected to their values, they feel like they can step into hard problems and find their voice, and that their local organizations feel like they've really developed a significant new capacity to approach their change-making work in a new way, and that we can build capacity in these local places so these groups grow and their impact grows, because we want policies to pass. I really am focused on policy change, and I think these groups are really well positioned to make that kind of policy change.
Sounds like an amazing fellowship and really well thought out. Well, thank you so much, Dr. Basu, for sharing all of the work that you're doing. Also, thank you not only for joining us, but quite honestly, for the work that you are doing. We've really appreciated learning so much more about the opportunities. I also wanted to thank our listeners. I wanted to make sure that everybody takes a moment to follow us on social media or check out our site. We will be posting more conversations like this one with folks who we find inspiring in this space and hope to offer inspiration to others.
Thank you again, Dr. Basu. It's been a pleasure speaking with you, and follow for those who are listening, follow Dr. Basu and all the work that he's doing. You will not be disappointed. And until next time, please help us make some noise for climate. Thanks.